So now we move into next chapters here. The chapters medication here talking about the cardiovascular, that means the heart and the blood vessels, and the renal, that means kidney drugs. So basically, we're talking about the renal here. We are not truly talking about the kidney illness. The drugs not truly treat the kidney illness. We're just talking some relationship kidney with the heart, with the blood pressure. We know kidney mainly functions relieve extra water, thus form the urine. But how much urine is reduced is depending how much water, like a cable inside the body, especially cable in the blood vessels. So that's basically we're talking about some body fluid and blood balance here. Yeah, we are not truly talking about the kidney illness. We're just talking about some balance here. So that's basically in this chapter and the drugs here. So the most commonly relationship with the heart and the blood vessels problems or disorder, the pretty common one, hypertension. We say hypertension is high blood pressure. If we changing ER to O here, hypertension will be low blood pressure. Lot of pretty similar words, similar illness name. They use hyper and hypo. Don't confuse. Congestive. Congestive is the illness like blood circulation problems. They may be hardly blocking or maybe totally blocking the blood circulation in the blood vessels. So that's a congestive kind of illness. Congestive kind of heart failure, that means more blood because they couldn't circulation to the tissues or maybe to the lungs properly, then they blocking or more in the heart, in heart channels. And angina. Angina is because coronary artery that supplies blood to the heart narrow or broken there, and the heart losing enough oxygen supply, and could be cause pretty severe problems later if not treated. And another issue is heart rate changing. Mainly is irregular heart rate. So that's the mainly issue we're talking about in this chapter. So medications, we may not able to totally curate the problems, but will be reducing like a patient getting sick the rate and reducing the death rate. So that's basically in these chapters. The first way we talking about anti-hypertension drugs. Anti-hypertension. Hypertension, we say that's high blood pressure. Anti-hypertension means we need reducing high blood pressure. So we say normally blood pressure is about 140, 90. So basically we say normally 120 over 80. But we have like some space here, like between 140 and 120. Like if people some like blood pressure go to 130 over 85, for example, we couldn't truly diagnose a patient have hypertension. But these kind of patients truly need to be careful. And maybe later on, they possibly got hypertension. So clinically, when diagnosis, patient have hypertension, that's blood pressure higher than 140 over 90. And also need measurement for 3 times. Yeah, 3 times. And different time, like today, we can measurement 1 time, and then tomorrow or maybe few days later, tell patient coming back. Just in case, because we know the blood pressure affected by many things, like some people's stress can cause the temporary blood pressure rising up, and also some emotions can cause exercises, maybe can cause even just after eating, can cause some high blood pressure. So that's why we ask patients coming back at least 3 times. All the blood pressure number over 140 and 90, then patient will be diagnosed for hypertension. But generally say, just the family doctor make a patient diagnosis for hypertension. Like for TCM, we are not truly make a diagnosis for patient hypertension. But clinically, if we find some people's blood pressure is pretty high, and if they don't have like history about high blood pressure kind of patient, we can tell them go to family doctor to check. So hypertension, we say generally say patient's blood pressure 140 over 90. So we have 2 numbers here. Yeah, 2 numbers here. High number is a systolic number, means heart like a chamber, especially ventricle contractions, pushing more blood go to blood vessels, thus pressure go to higher there. And when heart ventricle dilate, the pressure will decrease a little bit. So that's diastolic pressure there. So we separate with 3 different levels here. We calculate by the diastolic blood pressure only. We are not calculated by the high number here. We just calculate by the low number here. So this low number between 95 to 105, certainly if patient high part over 140, also including the 90 here, is mild. It's not that severe problem, but still hypertension. If the pressure, we're still talking about the low number here, between 105 to 115, that's the little bit severe, but still not that severe. But if the number over 115, that's the most severe kind of problem. So we say we separate for different degree because our treatment may be different. If patients like hypertension is not that severe, maybe we are not necessary to use the drugs or medication. We can use generally some control of our food to control the blood pressure. So we say low sodium. Yeah, low sodium, that's more important. So sodium mainly, that's the mainly can holding more water. When they holding more water go to blood circulation. That's truly cause the hypertension. So reducing the amount eating for sodium and reducing some body weight. That's another important aspect, reducing blood pressure. And do some exercise. Certainly exercises helping with reducing body weight also. And stop smoking. Smoking usually is nicotine inside. Nicotine have functions working for the blood vessels. Contraction blood vessels cause the hypertension. So if patient's blood pressure is a little bit high already, tell the patient stop smoke. And the same thing for alcohol. Stop drinking alcohol. So alcohol still can cause the blood vessels contractions, still can increase blood pressures. And we say sometimes emotions, stress, anxiety also can cause the blood pressure increase. So do some relaxations and even meditations, try to make more relaxing. And certainly for food, for diet, decrease to eating fat. So that's the mainly things. If patient have hypertension, like just the man is not that severe, or maybe severe kind of situation under the medication, still pay attention. It's not that means use the medication, treat hypertension, like the patient can do anything. Yeah, still be careful. Yeah, still be careful. Doesn't help with the treatment also. So the medication, with the medication treat hypertension. So basically, certainly we need reducing the blood pressure. So reducing blood pressure by few aspects. One aspect is reducing or decrease cardiac output. That's also heart output. We say the heart pushing blood coming out like per minute, how much millimeter they can pushing out, that means output or CO. Certainly, they go to blood circulation go to blood vessels. The big amount coming out, they form more blood inside blood vessels. And another depending how high the blood pressure, depending the blood vessels, we're talking about peripheral vascular, means small blood vessels on the terminal area, basically. Big blood vessels usually not that big changing. Even they bigger, but we just have few pretty big arteries. But small arteries, they all over the body, they are contracted and relax, make a totally big difference. So we're talking about peripheral vascular resistance, means how they can hold in the blood vessels. So that's PVR. And both. So basically, the drugs working with two aspects. One is decreased output. Decreased output, less blood go to blood vessels. That's truly decreased blood pressure. And also decreased the peripheral vascular resistance, means less holding there. Less holding there is a little bit more dilate. That means on the same amount blood is decreased blood pressure also. That's generally we say. So we say antihypertension kind of drugs, we classified by their functions to see what they truly doing. One kind of category is promote urination. That's we talking about from the beginning. We say the kidney is not truly treat kidney problems, but they working for the kidney, like a kidney producing more urine. When they producing more urine, that's truly reducing the blood value. And from reducing the blood value, then they reducing the blood pressure. So if patient have high blood pressure, sometimes the doctors give patient some drugs to promote urination. By this way, truly can reducing about 10 to 15 pressure in there. So it's pretty effective kind of medication. And another category of the drugs, they're working like a sympathetic agent. When we're talking about sympathetic agent, basically depressed kind of sympathetic actions. We know sympathetic nervous, which is talking about mainly actions. They make a heart jumping faster and stronger, and also make blood vessels contraction, and truly cause the hypertension. So basically, we need some like a blocker. We need some blocker. Block the sympathetic nervous function. And the third aspect is we have some drugs can directly dilate blood vessels. Thus, we're talking about the same amount of blood in the blood vessels. If the blood dilate, means make it wider. Certainly the pressure to the side of blood vessels here will be decreased. Similar, like in the same room, we put a lot of people inside or just a few people inside. Or maybe we go to a big room, the same people's number, the big room and the small room is totally different. That's pretty similar here. Like we have 10 people, 10 people. If you go to small room, like we are pretty hard to keep a social distance there. But 10 people, still 10 people, we go to a pretty big room, it's much easier. So that's dilate blood vessels directly. Then we're talking about another one. This one should belong to hormone. We didn't especially talking about in our endocrine systems. That's the neurohormone. Just recent years, is finding is producing by the kidney. Some special kind of glands in the kidney, they producing a special hormone. These hormones actions especially make the blood vessels contractions, holding the blood vessels. In other words, they can increase blood pressure. So certainly, we need some medication can specially working for this hormone. Generally say it's some enzymes can inhibit this kind of hormone. If these hormones amount decrease or it's not working, certainly they will relax blood vessels also. So that's the category of the antihypertension kind of drugs. I didn't go to special drugs or medications name here because it is so many. And clinically, maybe we don't have a chance to use it. I just tell you like why it's working and what kind of drugs in there. Later on, if you like your patients or even your family members have similar problems, and ask you and your understanding how the drugs working, so that's good enough. You just searching like which kind of drugs they working especially promote urination or maybe especially go to sympathetic nervous, and then you know how it's working. Then the second illness drugs, we go to the drugs to treat heart failure. So drugs treat heart failure, especially we talking about congestive heart failure. Last semester we talked about congestive kind of heart failure. Means the blood couldn't go to like circulation to the lung. That's usually causes left side heart failure. And let's go to right side heart failure. And if the blood couldn't go to like all over the body, like from artery, that causes the left side heart failure. And sometimes they may happen same time. And some more blood retentions in the heart. That's congestive kind of heart failure. So when heart failure, any kind of heart failure, we have other kind of heart failure. But whatever, any kind of heart failure, basically the caloric output will be decreased. And certainly, they will not send enough blood and oxygen to the tissues. That's the problem. So we say heart failure can cause by different reasons. One reason is the blood supply problem, coronary artery blocking. Coronary artery is a special artery sending blood to the heart muscles. If coronary artery blocking, certainly not enough blood sending to the heart muscles. Thus, truly no oxygen used for the blood, for the heart, and the heart losing their functions or decreased functions. And hypertension. Hypertension causes heart failure. Basically, it's resistance in big arteries because high pressure there. If heart try to sending the same amount of blood go to the big artery, they must be jumping harder, contraction harder. Long term later, the heart will be tired, will not like jumping stronger anymore. So that can cause the heart failure. And the other reason we're talking about heart muscles disorder, like some inflammations, especially possible happens in the heart muscles. The heart itself sick, they still couldn't jumping like strongly. Like some people getting sick, they couldn't do physical activity, similar like heart. And also other issues. Valves inside the heart cause the problem. We say, generally say, we will say anatomy of the heart. We have 4 chambers and we have 4 valves to separate with the 4 chambers. And another 2 valves basically is on the aorta, one is on the pulmonary artery. So any valve troubles can cause the blood flowing problems. And gradually later on will cause the heart failure. So that's generally speaking the reason causes heart failure. And the drugs treat heart failure. We can simply divide it with 2 categories here. One category with a positive inotropic effect. What means? That means make the heart muscles contractions stronger. Heart failure is the problem. Heart muscles is weaker for any of the reasons. They couldn't pump out blood strongly. So we can directly use some drugs to make it contraction stronger. And another category without directly working for the heart muscle, make it stronger. We will talk about some detail in this category later, but generally say we separate these 2 categories here. Then we go to the first category, make it muscle contractions stronger. So in this category, basically the drugs directly working for the heart muscles and the increased force of the contractions of the heart muscles. So that's some category here. It's not the single term here. I believe this one we are pretty familiar already. Sympathetic mimesis means pretty similar like sympathetic transmitters actions. Yeah, pretty similar there. Another important one that's strong, directly stronger the heart muscles. And the drugs without positive effect to heart muscles means they're working for other aspects. The other aspect is the first one still producing urine. Still urination. Yeah. Producing urine decrease the amount of the blood. We know like blood and urine, the relationship. Yeah, in our physiology class already. Blood circulation to the kidney, and the kidney have a both kind of blood unit there, and some like water coming out from the blood plasma, but without protein normally. Without blood cell, without protein, they filter out like mainly water, and then go to the kidney. Certainly they need reabsorption and then finally form the urine. So when we producing the urine means we try to relieve more water. More water relieves the amount of blood in the circulation will be decreased. So pretty effective, like we talked about before. It can decrease blood pressure also. So that means make the heart a little bit easily bump out of the blood. Yeah, blood pressure decrease small amount that much easily. And dilate blood vessels still decrease the blood pressure. Decrease blood pressure make the heart working easily also because less resistance in the circulation system. And we're still talking about these hormones inhibition. So still decrease blood pressure, make a heart working easily. So that's basically by these two aspects, like we treat heart failure kind of problems. So still I didn't put like individually medication's name, just understanding how it works. Then we go to another unit, agenda. Agenda, we just talking about that's because heart muscles don't have enough oxygen supply. Usually it's caused by coronary arteries problem, coronary artery blocking, and maybe blood so sticky inside. Then they cause the heart muscles don't have enough oxygen. And sometimes it's not truly blocking. It's coronary arteries, some spasm in there. So still decreased the amount of blood sent into the blood and decrease oxygen sent into the blood. So that's we're talking about that's agenda. Sometimes it happens just the spasm cause the coronary artery narrow. And certainly when coronary artery narrow, they couldn't send in enough oxygen go to the heart muscles, will cause the chest pain. So clinically for angina, mainly symptoms is chest pain, but usually it will reduce after a few minutes, but maybe happens again. So that's truly from the beginning. But later on, maybe narrow blocking the blood flow, and then something blocking inside. That's truly blocking the blood flowing inside. That's truly cause severe kind of problems. We call heart attacking. So that's even more severe than angina. But some people also happens start from angina. So the drugs used treat for the angina, that's pretty popular. Like sometimes we say if patient have hypertension kind of problems, or maybe sometimes they have chest pain and heart pain kind of situation. It's better keep this kind of medication like carry it every day. When something happens, you can directly use it. So that's directly relieve the smooth muscles of the coronary artery. We say the problems happens because coronary artery smooth muscles contractions make a coronary artery narrow and not sending enough oxygen to the heart muscle. So that's immediately can release. And this medication reactions pretty faster. And we don't necessarily to orally use. It's still orally use. I mean, it's not swollen down, not go to stomach. Can just put under the patient's tongue. So we say under the patient's tongue, we have some blood vessels there and the memory there. So it absorptions pretty quickly under the tongue. So immediately reactions. So these medication truly save a lot of patients' life. So carry it if people have this kind of problem. So we say it can working about just a couple minutes. Just holding it under the tongue. Just holding it under the tongue. So that's pretty good drugs. Pretty good drugs. And we also have some other drugs, but maybe not used for like acute attacking. So generally say they're working a little bit slowly compared with the first one. That's kind of beta blockers. And that's still can relieve these kind of problems, but not as faster like this category drugs. And something maybe trigger angina happens. Also need to be careful. For some people have this kind of problem, like they have chest pain before, but later on relieves. But possible after some exercises, possible after some big emotions can trigger it, because exercises and emotions truly increase the heart rate and increase the blood pressure and make the heart muscles contractions stronger. And at the same time, if patient have coronary artery troubled, it's trigger angina. So truly be careful. So we say beta receptor blocker can working for like as a prevention. but not attacking. And we also have some other medications also can working for agenda kind of conditions. Calcium channel blocking. Calcium. So calcium helps muscles contractions, including smooth muscles and like the muscles on the limbs. Yeah. So if we blocking the calcium blocker there, it's like kind of a relief, or maybe make the muscles not contractions so strongly. So decrease the heart muscles use oxygen. Yeah, so that's from this aspect it working. And we also have some other drugs. We also have some drugs. Basically, these category, including aspirin, everybody may be familiar. These category drugs make the blood flowing more smoothly. We know in blood circulation, we have some protein inside, we have some cells inside, and we have platelets inside. Especially platelets, like we talking about, if some part of blood vessels is broken or unsmoothly in there, they thinking about it's injured there. They will go together and change from inactive kind of form, unactive form, kind of form. So basically, and especially some people like eating too much fatty food make the blood so sticky. So this category of the drugs just try to relieve that sticky kind of blood and make the blood flowing more easily. So that's also helps this. So aspirin, yeah, aspirin, very familiar. I believe most people familiar with it. It originally is treat like people got common cold, fever, and reducing the fever, that kind of medication, and relieve some pain. And just past like 40 or 50 years, and then doctor found aspirin have pretty good reactions can working for the blood circulation. So right now, a lot of people use aspirin treat like people have hypertension or maybe blood so sticky, and use this one. And truly reducing the risk people got a heart attack. So that's in this category. Then we go to another illness. So another illness we talking about irregular heart rate kind of problems. So the heart rate, certainly if you feel the pulse, we can feel it. Yeah, we can feel it. It'll be regular. Yeah, it'll be regular. But it's not that clear. But if we go to like, certainly we have special kind of machine, ECG, we can truly test for electrical happens in the heart muscles. And that can like, if patient have some irregular heart rate kind of problems, we can immediately find it. Yeah, it's more clear than we just feel the pulse. So that's the heart. Yeah, that's the heart. In our heart, we have a special kind of systems we call it conduction systems. So conduction systems deliver the electrical signals to the whole heart muscles. So we have SA nodes located on the right side atrium, the wall of atrium, the wall of atrium. And we have AV nodes. AV means A means atrium, V means ventricle. So that's atrium, that's ventricle. So it's located in the heart muscles between the atrium and ventricle. So it's the picture is pretty hard to put in there. Look like they're still in the atrium, but it's not truly. It's on the wall between the atrium and the ventricle. So that we call AV node. Then we have some bunch. The bunch sends the signal to all over the heart muscle. So that's the special conduction systems of the heart. SA nodes, that's the pacemaker. So like how heart beating, the rate is depending by the SA nodes. So certainly, irregular heart rate happens mainly caused by SA nodes problems, but still possible by other reasons. So drugs we use treat irregular heart rate problems. Basically, we have few categories here. Basically, we have five. We have five categories. The first category, sodium channel blocker. So sodium channel blocker, basically, it can increase the anxiety of the heart. So heart rate problem sometimes is so slow. It's so slow. We try to make it so excited. It's let it be catch up. That's working coming from sodium channel blocker. And we also have beta adrenaline kind of blocker in there. So that's mainly for somatic nervous systems. Beta receptors stimulation, it will be increased like heart contractions and increase the heart rate. But if we use the blocker there, that we can like slow down the rate. So heart rate problems could be too fast, could be slow, and both can have like a missing beat kind of problem. Missing beat. So that's generally we pick up different blocker and try to maybe catch up heart rate and maybe slow down the rate. Then we have another blocker here, potassium channel blocker. So potassium still relationship with heart muscles contractions. So that's these kind of drugs usually treat. It's pretty hard kind of like faster kind of heart rate kind of problems. They basically directly working for SA nodes and AV nodes, blocking them, make it slow down. Another category here, calcium channel blocker, where we talked about this one before. So calcium blocker here, so through blocking the calcium channel and the regular heart rate. The next category, that's we say, it's a bigger category here. Typically the medication name digoxin. Digoxin can directly working for heart muscles, but when they use different dosage, the reactions may be a little bit different. But truly, when they working through the vagus, that's the cranial nerve number 10 to the heart and the reaction there. So heart rate problems is pretty complicated problems. I just gave you some basic idea here. We have 5 different category kind of medication can treat these problems. Then the last unit, we talking about the drugs to treat hypertension, low blood pressure, and shock. So some is the problems like not enough blood circulation to the tissue and not enough oxygen sending to the tissue or organs. So we use the medication, truly we need to increase the volume of the blood in the circulation. So we have different categories to treat these problems. The first category, we try to increase blood volume. That means we can directly give patients blood, blood transport. And even we can only give patients blood plasma and some plasma, some like people vacate plasma and some plasma substance, and even just some water and solid inside, kind of liquid. Another category we're talking about, we give some drugs make the blood vessels contractions. We say low blood pressure and shock, when they happen, they both like not enough blood sending to the local. When we make the blood vessels contractions, that truly can increase the blood pressure. Blood pressure increase will sending more blood to the local. So in this category, we're still talking about some drugs pretty similar actions, like some prosthetic nervous actions, like we talking about before, something similar, adrenaline or non-adrenaline kind of medications. And we also can use some other medication directly, it's not through the sympathetic nervous, directly working for the blood vessels, make blood vessels contractions. So that's very pretty familiar already. We say that's working as make blood vessels contractions coming from the kidney. And we also have another hormone, ADH, that's coming from our pituitary gland and gland symptoms. That's anti-urination, means reducing urination. Reducing urination will be keeping more body fluid inside the body, means keep more blood inside. So that's this category. So that's basically treat hypertension or shock. The symptoms of shock basically happens because decreased blood supply to the tissues. The common symptoms, less urination, and also can cause heart failure and mental confusion, or maybe syndrome, and cold terminals, and people even lose consciousness. So we say most people shock, their blood pressure will be dripping down, hypertension, but not all the patients. Yeah, not all patients. We have different type of the shock. So we need to see what's the cause, and then we choose the different kind of medication to treat. Like we talked about before, if caused by the bacterial infections, truly we need to use antibiotics. So that's about